The title of this video is, how did my rotator cuff tear if I didn't have an injury? So the rotator cuff is a group of 4 muscles that encapsulate the shoulder, and it creates stability there, and it's in actually a relatively tight space. We used to think that the acromion pressed on the rotator cuff and it would cause tears there, but that actually has been disproven over the years. Really, it's a matter of blood flow to the tissue is what we've seen, and across people's lives, they get less and less blood flow to certain tissues. Our tissues also become less elastic, right? So think about a rubber band that when you stretch it out, it returns. Well, if you look at your skin, right? When you take the skin of a toddler and you kind of pull it back, it bounces back. Well, take the skin of your grandma or someone's hand who's 80 or 90 years old, and when you pull it, it doesn't rebound as well. So when you have tissues inside your body that they have less elasticity and they have less blood flow, they don't respond as well to the repetitive stresses, and that can cause tears, which can progress over time. So that's how most rotator cuff tears occur.